Michigan is known for its natural beauty, with endless shorelines, hidden trails, and massive forests. What it's not known for are deserts, sometimes hidden in plain sight. In central Michigan, the northern Lower Peninsula, and the Upper Peninsula, both adults and children facing mental health challenges are struggling to find the help they need.
The northernmost state psychiatric facility is in Cairo, Michigan, which is in my district. That's a long ways from Traverse City. It's a long ways from the bridge, and so it's even longer from some place like Marquette or Menominee. What a desert looks like is when a person is in crisis and they need support, and maybe they go into Munson for a ER because they don't know what to do.
State Representative Matthew Bierlein serves as the chair for the House Oversight Subcommittee on Public Health and Food Security, which recently released a report on the state's underperforming behavioral health system. The investigation found Michigan ranks 47th in the nation in psychiatric bed space.
Decades of disinvestment. Psychiatric care is hard, right? It's first of all, I think people in general, like the general public, has a hard time wrapping their head around mental health needs. In addition to that, we had in this country a history of not handling mental health facilities very well. And our answer to that in the late 90s and the early 2000s was to close state-run facilities. That process has been a major factor as to how we got where we are today.
When broken down by the numbers, the shortage is shocking.
When I tell people that the national average is between 30 and 40 beds per 100,000 people, and in Michigan we have 19, and the majority of those that are actually acute beds run by the state is much less than that.
Construction is underway on 3 major inpatient psychiatric facilities in the Lower Peninsula. The Southeast Michigan Psychiatric Hospital in Northville Township, with 264 beds, fully funded by the state. The U of M Sparrow Behavioral Health Hospital, a public-private partnership with 120 beds. The Southridge Behavioral Hospital in West Michigan, a private joint venture with 96 beds. And earlier this year, Pine Rest, a private provider, opened Michigan's first pediatric psychiatric care facility in Grand Rapids. But as you head further north, the help is simply not there.
I guess 50% of our adults are being sent downstate or out of state. All of our kids, of course, have to go downstate or out of state because the 21 counties of northern Michigan, we have 0 beds for kids.
Kate Dahlstrom is the president of the National Alliance on Mental Illness for the Grand Traverse chapter.
Approximately 2018, when we moved up here full time, our youngest son was struggling, and I didn't have a clue where the resources were to get him help. And so I'm not even sure how I found out about NAMI, but I did. And I took one of the classes and attended some support groups. Then the more involved I was, the more I realized that we have some serious gaps in our mental health continuum of care that we need to fix. Families have been struggling in a huge way for years. And so we're making noise up here in northern Michigan, and it's time for a change.
The recent report outlined 6 major recommendations to deal with the problem, including establishing a dedicated behavioral health campus in northern Michigan.
It's called the Northern Michigan Mental Health Campus, and it would a state of Michigan inpatient and residential treatment center serving children and adults. So we found a pretty central location where there's, a lot of northern Michiganders could access this, and the location was just west of Kalkaska.
It's unclear when this project will potentially move forward. For now, families are trying to navigate the system in real time. What actually happens if you're a person in central or northern Michigan in the middle of a mental health emergency, or are trying to find help for someone that you care about? In these desert areas, the first stop is almost always a local emergency room.
CMH comes in usually within about 3 hours, community mental health, CMH, within about 3 hours. That's kind of the standard to do an assessment. And then they start looking for placement. Closest place to some place like Traverse City is probably Grand Rapids-ish. We know that family support, family input, caretaker support, just loved ones being involved in your recovery is really important. and now they're a 2.5-hour drive every time you have to have a family therapy session. It's not conducive to treatment. It's not conducive to healing. As a result of that distance and that lack of beds in northern Michigan, whether it's in the UP or it's just in northern Michigan, it causes long-term lack of care. It's why people wind up not being treated, because they don't have access to it.
Corey Thompson is the clinical director at Pleasant Psychology in Mount Pleasant and specializes in helping children aged 2 to 18. She says it's not uncommon to see local families make significant sacrifices to get a child time in therapy.
We have numerous families that are traveling over an hour to get here. And I would say the reason being is because in the areas that they live in, there's not a facility that specializes in child mental health. If you have an 8-year-old, we don't want them just to see somebody who works in mental health. It is somebody needs to see an 8-year-old who specializes in child mental health. Like right now, I'm thinking of a family who travels weekly to come and see us that travels an hour and 20 minutes one way. And it breaks my heart, but at the same time, I'm so grateful that they're willing to come here.
Thompson warns, even when families manage to track down an outpatient provider, health insurance roadblocks and steep out-of-pocket expenses regularly force parents to make some tough decisions.
We have some kids that are coming twice a week because of the severity of their needs, the co-pays, the cost it takes, the time to come off of work, the kid missing school. It is an extreme financial barrier for families. There shouldn't be a financial barrier to getting a child the help that they need.
Local providers and advocates agree that fixing the shortage isn't just about building new facilities. It's about changing how the entire system works from start to finish.
If you had a heart attack or anything else that you had fixed in the hospital, you go home and you've got physical therapists, you've got occupational therapists, you've got immediate everything. That doesn't happen with mental health. You're discharged and good luck. So long, hope we don't see you again. We're wasting millions, probably billions of dollars because we're not doing it right in the first place, the first time.
I think it's a problem that doesn't get solved by any one person. It will take coalitions of people coming together, and it can't be, the state can't fix it by itself, and the privates can't fix it by themselves. Community mental health is not going to fix this by themselves. It's going to take everybody working together to make this happen, because it's the only way we're going to get a handle on the current situation.
If a family has to call for 6 months, they're going to stop calling, right? And because it's exhausting. It is fully exhausting. So yes, to be able to eliminate all of those barriers would just be calming, peaceful, just allow a family to get the support that they need.
Finding the right care in northern and central Michigan can feel like an uphill battle, but immediate support is within reach. If you're struggling, call or text 988 to reach the Suicide and Crisis Lifeline.